All right. So welcome to our first tutorials on GMDC internal medicine. Internal medicine. All right. Patient P reported to your facility with fever, severe headache, no child rigidity, nausea, and vomiting. In his history, he went to the northern region a week ago. Prior to presentation, he had a tonic-clonic seizure. So we are talking to what, or we are referring to a person with fever, severe headache, rigidity or neck stiffness, nausea, and vomiting. And he has a history of traveling to the northern region of Ghana. Ago. Of course, talking about Ghana. Now, he also had what? Tonic-clonic seizure. So you ask yourself, what disease or what diseases can cause someone to have fever, headache, in other words, to have meningism. These are signs of meningism. Meningism. So that's what we're going to be looking at in this question. So anything that comes to your mind that you think can lead to meningism, please write it down. Or that is what the question is talking about. All right. So now let's begin. What is the likely diagnosis? Definitely, you are looking at what? Meningitis, especially with a history or with a travel history of what? Or to the northern region. To the northern region. So we're having what? Meningitis, and this is likely to be bacterial. And so therefore we can say our likely diagnosis is bacterial meningitis. Bacterial meningitis. So that should be what you should be looking at for. For diagnostic features of this condition. For diagnostic features. In other words, what features will help us know that indeed this person is having bacterial meningitis, or simply put, meningitis. One, you can talk about what? Neck stiffness. Neck stiffness or no child rigidity. Neck stiffness. That's inability to flex the neck forward passively due to an increased neck muscle tone and stiffness. We can also talk about Kernick's sign. Kernick's sign. And this is assessed with the person lying in a supine position with the hip and the knee flexed to 90 degrees. Now, in a person with a positive Kernick sign, pain limits passive extension of the knee. Pain will limit the passive extension of the knee. And so therefore, if this is possible or if this is true, then it is a sign of meningism. It is a sign of meningism. The next point is the Brudzinski sign. Brudzinski sign. And a positive Brudzinski sign occurs when flexion of the neck causes involuntary flexion of the knee and the hip. I repeat, it is positive when flexion of the neck causes involuntary flexion of the knee and the hip. So when that is positive, then it is a sign of meningism. And again, you can talk about photophobia. That is intolerance to bright light. Photophobia. You can also talk about phonophobia. Phonophobia. That is intolerance to loud noise. Intolerance to loud noise. You can also talk about intoxication syndrome. An example of intoxication syndrome is the headache, the fever, the nausea, and vomiting. All these are together, we call them intoxication syndrome. Intoxication syndrome. So again, what are your diagnostic features? Neck stiffness, Kernick sign, Brudzinski sign, photophobia, phonophobia. Then, of course, you can talk about intoxication syndrome. Intoxication syndrome. What likely organisms may be involved? So, if we are looking at bacterial meningitis, due to the history of this person, what organisms could be the causative agent? Of course, you can be thinking of what? Neisseria meningitis. Neisseria. Then you can talk about what? Streptococcus pneumonia. Streptococcus pneumonia. Then you can talk about Haemophilus influenza. Haemophilus influenza. So any of these will be correct. Now let's for differential diagnosis of meningism. For differential diagnosis of meningism. So what can cause the Brudzinski, the neck stiffness, the Kennex, photophobia, phonophobia? What can cause it? These are what? Meningism. So what are the differentials? So you can be looking at a brain abscess. You can be looking at brain neoplasms. You can be looking at delirium tremens. You can be looking at subarachnoid hemorrhage. You can be looking at encephalitis. And then febrile seizures. Febrile seizures. Febrile seizures. You can even talk about sepsis. When you have severe sepsis, it can also lead to meningism. So again, brain abscess, brain neoplasms, delirium tremens, subarachnoid hemorrhage, encephalitis, febrile seizures, febrile seizure or febrile convulsion. All right. What investigation are you going to do in this patient? What are you going to do? So of course, if for nothing at all, you can't forget your lumbar puncture, because lumbar puncture is one of the most diagnostic tool or investigation that we do for people suffering from meningitis. So you do what? Your lumbar puncture. Then of course, you can do your full blood count. You can add blood culture and sensitivity, BUE creatinine, and then you can even add head CT scan. Head CT scan. So again, lumbar puncture, full blood count, blood culture and sensitivity, BUE and creatinine, head CT scan. These are the investigations you are going to do. So you mentioned them. How will you manage this patient? How are you going to manage this patient? Again, the question didn't say that this person is coming to you in an emergency case. So please forget about that protocol. Okay, go straight and treat the patient. So what are you going to do? So in your management, you are going to control the seizure or the convulsion. You are going to control it. So you're going to monitor and control the seizure. And to control the seizure, you need to give anticonvulsant. You can give anticonvulsant like the diazepams, the lorazepams, the phenytoin, and so on and so forth. You can give these drugs. So any anticonvulsant is okay for the treatment. Then you can look at for what? Or you can give IV antibiotics. IV antibiotics, especially ceftriaxone. And of course, you can add ampicillin to it as well. Then you might want to control the fever or antipyretics. So you can give antipyretics like the paracetamol. Antipyretics. That is a control of fever. Antipyretics. So paracetamol can also be given. So these are what your management protocols or procedures. Again, seizure monitoring and control. And you can give anticonvulsant like the diazepams and co. You can give the appropriate IV antibiotic example, or especially ceftriaxone. And of course, you can also give ampicillin. Then you might want to give what? Antipyretics. Example, paracetamol. All right.